So here we are going to see our one more topic from central nervous system, drug acting on CNS. There is one topic known as a central central analgesics. So in the previous lectures we have seen non-steroidal anti-inflammatory drugs. Also complete. We have also completed few topics from drug acting on CNS. Particularly, we have seen general anesthetics, sedative hypnotics, then anticonvulsants, alcohol, etc. etc. So in this session, we'll see known as a central analgesics or a opioid analgesics or opioidal drug or opioids. Okay, are you able to see the screen properly? So first of all, there are two kind of analgesics. Basically, not only two. There are three kind of analgesics. So first one is known as a central analgesics. Second one is known as a NSAIDs or peripheral analgesics, and third one is known as a endogenous analgesics. So what do you mean by central analgesics? Central analgesics, central analgesics mean those are the drug which will relieve your pain, which will increase the pain threshold, which will increase the pain threshold, which will relieve all the pain by acting on central nervous system. Okay, they will decrease your pain by acting on CNS, and they produce drowsiness. They will induce sleep and all that. Okay, but without interfering your motor coordination. So those are the drugs which affect your CNS. They relieve your pain by acting on CNS. Those which produces the drowsiness or which sedate yourself. So these are the central analgesics. So central analgesics means these drugs which will produce a drowsiness or will produce a sleep with decrease in the pain sensation, and they will decrease your both pain. Okay, the pain arising from peripheral, whatever the responses are there. So any noxious response or any abnormal, any noxious or unpleasant sensory experience, so that will be relieved by central analgesics. So what is pain? First, pain means what do you mean by pain? So pain is nothing but the unpleasant sensory or emotional experience that which actually or which may or may not be associated with the any tissue damage. So that is nothing but the pain. So what do you mean by pain? Pain is nothing but the any unpleasant sensory or emotional experience associated with the actual or potential tissue damage described in terms of such damage, or they are described described in terms of such damage. So if there is any damage to your tissue, or if there is a potential damage to tissue, so you are getting one noxious sensory experience, and what we call it is a pain. So that is pain. So now that pain is arising from different pathway. There are two different pathway. So pain arising from endogenous chemicals, pain arising from tissue damage. That is, these are two different types. So before that, we'll see what are the different types of pain. कि आपको दर्द कितनी कितने टाइप के होता है. दर्द में भी बहुत सारा टाइप होता है. So there are different types of pain. So first of all, pain is nothing but an unpleasant sensory or emotional experience that is associated with the actual or potential tissue damage or described in terms of such damage. So it may be either sensory experience or it may be either emotional experience. So sensory matlab if you got a damage, your peripheral nerves will send a signal to brain. That is noxious signal. That is also pain. But sometimes if there is no damage to tissue, but still you feel pain, that is known as emotional pain. So it may be either sensory experience or it may be either emotional experience, which may or may not be associated with the tissue damage or may be associated with the potential tissue damage or described in terms of such damage. That is known as pain. Now what are the different types of pain? So there are different types of pain. So first one is known as superficial pain or cutaneous pain. First one is known as superficial pain. So superficial मतलब ऊपर ऊपर का pain. ऊपर ऊपर का पेन मतलब क्या? That pain is arising from your skin and mucous membrane or felt. Okay, so whatever skin is there, skin or mucous membrane is there. So if pain is arising from any skin or mucous membrane, that is known as a cutaneous pain, superficial pain or cutaneous pain. So that may be experienced in a different way. Superficial or cutaneous pain may be experienced in a different way. Like That pain may be felt as a pricking sensation, stinging sensation, or burning sensation. So cutaneous pain may be described and by three sensations. These are nothing but the three sensations. That is nothing but the pricking. आपको अगर कुछ चुभा हो, that is known as a pricking. सुई चुभी है आपको, that is pricking. Stinging and burning. Burning तो आपको मालूम होगा. Stinging and burning. So these they are felt as a either pricking, stinging, or burning. These are known as a superficial or cutaneous pain. Then there is another type of pain known as a deep non-visceral pain, which arises from muscles, joints, and ligament of and bones. So that is known as a deep but non-visceral pain. Visceral means those arising from visceral organ. Deep non-visceral and deep non-visceral pain arising from muscles, joints, and bones. So also it is also known as a somatic pain. Just a minute, I will admit. So first one was a superficial or cutaneous pain, and second one is nothing but the deep non-visceral pain or pain arising from muscle, joints, ligaments, and bones. So whatever pain you are getting from damage of any muscle or damage of any joint or damage of any ligament or inflammation of same. So whatever pain is there, that pain is nothing but the deep non-visceral pain. Okay, it is also known as a somatic pain, and generally it is because of the inflammation of your muscles, inflammation of joint, ligament, or any breaking or damage to the ligament, like that. So here sticking sensation due to autonomic, it is a sticking sensation due to autonomic response. So that is a deep visceral pain. Superficial pain means pain arising from your skin and superficial mucous membrane, which may be felt by your peripheral nerves like a pricking, sticking, or burning. So that is superficial. Deep pain that is arising from muscle and joints, ligament. Then next one is a visceral pain. Visceral pain, as the name indicates, visceral means those arising from visceral organs. Visceral means internal organs. This type of pain is less localized, diffuse. The pain will diffuse low. It may be felt as a spasm. For example, if you got your intestinal spasm, that is a visceral pain. If you got a renal spasm, that is a visceral pain. So pain due to myocardial ischemia, that is also visceral pain. Then inflammation like appendicitis, so pancreatitis. So any inflammation or infection to the internal organs, so that pain will be felt. That pain is known as a visceral pain. So pain arising from your visceral muscles और सॉरी विसरल ऑर्गन्स. तो विसरल ऑर्गन कौन से आपके, जो भी आपका इंटेस्टाइन हो गया, आपका किडनी हो गया, यूरेटर हो गया, और ठीक है आपका इंटरनल ऑर्गन्स लाइक पैंक्रिया आपका, देन आपका हर्ट हो गया. So whatever the inflammation or pain arising from these kind of visceral organ, so they are known as a visceral pain. Visceral pain, remember types of pain: superficial pain, which is also known as cutaneous. Okay, then deep non-visceral pain. Then third one was visceral pain. Suppose that your stomach has some ulcer known as a peptic ulcer. That pain arising from the inflammation of that your mucous membrane of your stomach, that is known as a visceral pain. So that pain which is arising from joints, muscle, ligaments, or bone inflammation, that is known as a deep non-visceral pain. And superficial pain, that is arising from your superficial mucous membrane and skin. Now these are the where there is a actual damage. There is another kind of pain known as a referred pain. Referred pain मतलब क्या है, यहाँ पे पेन एक जगह पे होगा आपको और दर्द आपको दूसरी जगह पे होगा. एक जगह पे पेन होगा, दूसरी जगह पे दर्द होगा. So it is a type of deep pain, whether visceral or whether it may be either visceral origin or maybe either somatic origin, and it is interpreted as a coming from some another part rather than the actual site of stimulation. Means यहाँ पे क्या होगा कि आपका suppose that आपको angina pectoris है, so anginal pain is a 99% known as a referred pain. So 99% में anginal pain जो होता है वो refer होता है. Anginal pain means the pain arising from your heart. Okay, so pain is arising from your heart. The origin of pain sensation is nothing but your heart organ. So due to coronary vasospasm or blockage, so whatever pain is arising in angina, that is a anginal pain. So that actually originating from your heart muscle or artery, coronary artery, but that pain is felt at a left side of your body. So left side of your hand and left back of your thoracic thoracic left back. So the pain, left neck, etc. etc. So pain is arising from that hurt, but it is feeling at left hand, then left neck, then left back. Okay, so that is known as a referred pain. So deep, it is a type of deep pain, or it might be either visceral pain, which may be either somatic origin or somatic pain or visceral pain, but it is felt at another place rather than the actual site of stimulation. That is known as a referred pain. Now another kind of pain is there known as psychogenic pain or functional pain. So it is usually by virtue of pain which follows no definite anatomical pattern of distribution. मतलब यहाँ पे आपको पता ही नहीं चलेगा आपका डैमेज कहाँ पे हो गया है. अब फॉर एग्जांपल you might have heard the term trigeminal neuralgia. So there is an inflammation of trigeminal nerve, trigeminal neuralgia, or that is also adverse effect of some drugs also. In that case, you will not have any tissue damage, you will not have any organ damage, you will not have any deep pain, visceral pain, etc. But you are getting noxious sensations, you are getting pain sensation. So that type of pain is known as psychogenic pain or functional pain. मेरे को दर्द हो रहा है, कहाँ से हो रहा है कुछ भी नहीं हो रहा, सिर्फ हो रहा है. That is a psychogenic pain or functional pain. So there are different pain pathways in a very short way. I'm not going to demonstrate all the things. I'm just highlighting the important points for your GPAT exam, Niper exam. Okay. So first is known as first there are two pain pathways. There are two pain pathways. First is a pain that is arising from pain mediators. Pain mediators. So there are certain endogenous chemical in your body. For example, histamine, acetylcholine, bradykinin, 5-hydroxytryptamine, prostaglandin, PGE2 particularly. These kind of endogenous chemicals, they are responsible for the pain and inflammation. Particularly this histamine, bradykinin, 5-hydroxytryptamine, and your prostaglandin. So these chemicals, they are known as a pain mediators. So whenever they will be released at a specific area of your body, so your body will feel pain sensation. So they pain arising because of the pain mediators. आपको अगर कहीं जख्म हो गया तो वहाँ पे क्या होगा, वहाँ पे इन्फ्लेमेशन होता है, हिस्टामाइन रिलीज होता है, वहाँ पे ब्रैडिकाइनिन रिलीज होता है, वहाँ पे सेरोटोनिन रिलीज होता है, वहाँ पे प्रोस्टाग्लैंडिन, वहाँ पे बायोसिंथेसिस होता है. All these are the mediators of pain. That's why you are getting pain over there. That is a pain mediated by pain mediators like histamine, bradykinin, serotonin, prostaglandin, etc. etc. Now there is another pathway for pain. That is nothing but the spinothalamic pathway that terminates into thalamus and post central gyrus, which is mainly responsible for the localization of pain sensation. Now this is a neurogenic pathway. This is a chemical pathway, and this one is known as a neurogenic pathway. तो पहला जो है that is because of the pain mediators, chemicals pain mediators, that is known as a chemical pathway, and second that is the responsible for the localization of pain sensation. So that is known as a spinothalamic pathway. Okay, that is a neurogenic pathway. I'm not going to explain you all the details of this pathway. It is not much important for your GPAT exam. So this is the different types of pain. Okay, different types of pain sensation and different pathway for pain. Now, what do you mean by analgesic drug? So analgesic means any drug that will relieve your pain without causing loss of consciousness. Without causing loss of consciousness. Remember, any drug that will relieve your pain without causing loss of consciousness. That is known as a analgesic. So now these analgesics may be of different types. So narcotic analgesics, non-narcotic analgesics, then other analgesics. There are three kind of analgesics. याद रखो यहाँ पे three type के analgesics होते हैं यहाँ पे. Three types के analgesics होते हैं. First one is known as a narcotic analgesics. Narcotic analgesics, they are also called as a central analgesic or opioid analgesics. They will relieve your pain by interacting with the opioid receptor, and they will produce sedation. They are known as a narcotic analgesic. Narcotic analgesic. Another analgesics are there. They are known as a non-steroidal anti-inflammatory drugs or analgesic drugs. So they will not interact with the opioid receptor. They will not have any structural resemblance to your opioid drug like opium, morphine, codeine, etc. And they will have a totally different action. Okay, will have a totally different action. That they are known as a non-steroidal anti-inflammatory drugs. The third category is also there. So other category, uncategorized drug, for example, barbiturates, benzodiazepines, they are seen as depressant drug. They also decreases your pain sensation. There are three kind of drugs that will decrease your pain. So analgesics are the three type. First one is known as a narcotic analgesics, those which allow structural similarity or either structural similarity or either pharmacological similarity with like morphine, codeine, thibin. से ओपियम का जो भी अल्कोलाइड्स होता है उसमें जितना आता है आपका मॉर्फिन कोडीन थिबेन पापावेरिन वगैरह either those drug will have structural similarity with the opium or those drug which will have a pharmacological similarity with the opium. Those are known as a narcotic analgesic. They will produce sleep, narcosis, okay, and narcotic analgesic. Opioid analgesics is the term again. The term is used for those drugs which will interact with the opioid receptor. They are known as opioid analgesics. Now, NSAID we have seen already. In that in the last lecture we have seen non-steroidal anti-inflammatory drugs. Now we'll see the next. We'll see each and everything about the morphine and opium alkaloids. Now opioid analgesics. As I have told you, what do you mean by opioid analgesics? These are the drugs which will interact with the opioid receptors. Opioid receptors, or these are the drugs which will have a structural similarity with the opium or its derivative. So they are classified into different classes. First one is known as agonist. Okay, agonist means those drugs which are agonist to opioid receptor. So opioidal analysis means what? Opioid analysis means those are the drugs which will interact with the opioid receptors. Opioid receptor कितने टाइप के होते हैं? बाद में बोलता हूँ आपको. Mu, kappa and delta. There are three kind of receptor known as opioid receptor. Mu receptor is there, kappa receptor is there, and delta receptor is there. These three receptors. Now these drugs will either interact with these receptor. They are known as opioid analgesics. So in that we have agonist. So agonist like morphine, codeine, pethidine, methadone, oxypane, levorphanol, then tramadol. So these drugs are the agonist to opioid receptors. तो जो म्यू कप्पा डेल्टा है आपका, these are three opioid receptors, म्यू कप्पा एंड डेल्टा. इनके एगोनिस्ट कौन है? ये मॉर्फिन, कोडीन, पेथिडीन, मेथाडोन, प्रोपोक्सिपेन, लेवरफेनॉल and tramadol. These are the agonists to the opioid receptors. So agonist drug. Then there are certain drugs which are a partial agonist to opioid receptor. So in that you have buprenorphine and meptazinol. These two drugs, buprenorphine and meptazinol. These two are known as a partial agonist to the opioid receptor. It is very important. इसके ऊपर क्वेश्चन आ चुका है GPAT में. Okay. Then next class is known as a mixed agonist antagonist. Mixed agonist antagonist. That means these kind of drug they have agonistic property with the one receptor and agonistic property with the one receptor and antagonist property with the other opioid receptor. So opioid receptor कितने हैं आपका? Already बोला मैंने, म्यू, कप्पा एंड डेल्टा. म्यू, कप्पा, डेल्टा ये तीन रिसेप्टर है आपके opioid receptor. ये ड्रग अगर म्यू को एगोनिस्ट है, कप्पा को एंटागोनिस्ट है, तो उसको बोलेंगे मिक्स्ड एगोनिस्ट एंटागोनिस्ट. So for example, you can see agonist to one receptor and antagonist to other receptor. Like this nalbuphine, pentazocine and terphenol. These are the three drugs which are known as mixed agonist plus antagonist. याद रखो इसको, ये classification. So agonist कौन है आपका? याद रखो, agonist morphine, codeine, thibin, morphine, codeine, pethidine, methadone, propoxypine, thibin. Okay, thibin को तो कोई analytic activity है नहीं. Levorphanol, tramadol. Partial agonist कौन है आपका? buprenorphine and meptazinol. Then mixed agonist antagonist कौन है आपका? nalbuphine, pentazocine and butorphanol. Now there are certain protein present in the brain, which there are endogenous protein in the brain which have very strong opiate like analgesic. Peptides like strong opiate like analgesic and mu receptor binding activity now known to be present in the CNS and other tissues. So opioid peptides or opioid like peptides. So these peptides are already present in your brain. कभी कभी आपको बहुत ज़्यादा लग जाता है लेकिन पेन नहीं होता because of that these peptides. So opioid like peptides, opiate like peptides. So कौन से हैं, कितने हैं, कहाँ पे हैं? First one is known as a beta endorphin. First one is known as a beta endorphin. It is a potent analgesic derived from. It is a potent analgesic derived from melanocortin. So it is derived from melanocortin. opiomelanocortin. It is found in the pituitary and released along with the ACTH, adrenocorticotropic hormone. तो इसके साथ में ये बीटा एंडोर्फिन रिलीज होता है. इट इज अ पोटेंट एनाल्जेसिक्स. पोटेंट एनाल्जेसिक मतलब वेरी पोटेंट मतलब very less quantity is required to show analgesic activity. By potent, beta endorphin is a endogenous peptide which has an analgesic activity. Another is there enkephalins. So enkephalins is also secreted in the pituitary gland. Then it is also present in the brain, GIT, spinal cord and pancreas and adrenal medulla. इतने जगह पे होता है enkephalins. The gland, brain, spinal cord, pancreas वगैरह. Next one is dynorphin. Dynorphin, it is again widely distributed in the CNS. तो ये सेंट्रल नर्वस सिस्टम में होता है, ब्रेन एंड स्पाइनल कॉर्ड में. इसका टाइप भी होता है डायनोर्फिन ए एंड बी. तो उसके बाद में आपका आता है नॉसिप्टिन और ऑर्फेनिन प्रोटीन. नॉसिप्टिन और ऑर्फेनिन प्रोटीन. तो इट इज अ पेप्टाइड behavioral and pain modulating effect. Complex and distinct from O3. तो ये जो तीन है बीटा एंडोर्फिन, एनकेफेलिन एंड डायनोर्फिन, इनसे थोड़ा सा अलग है नॉसिप्टिन. नॉसिप्टिन को बिहेवियर कर सकता है आपका. पेप्टाइड विद बिहेवियरल एंड पेन मॉड्यूलेटिंग इफेक्ट. So these peptides, these first three, beta endorphin, enkephalin, and dynorphin, they have only analgesic property. This nociceptin will have analgesic property with it has a capacity to alter the behavior of your human. That is nociceptin. Another one is that known as endorphin 1 and 2. Endorphin 1 and 2. Tetrapeptide, high selective affinity for the mu receptor. Mu receptor. These are the opioid-like peptide. So endogenous peptide which having analgesic activity. इसके ऊपर भी एक बार क्वेश्चन आ चुका है GPAT 20 में. तो इसके ऊपर क्वेश्चन ऐसा था कि the following is not a endogenous opioid peptide. याद रखो यहाँ पे बीटा एंडोर्फिन is there, enkephalins are there, dynorphins are there, nociceptin are there, then endorphin 1 and 2 are there. These are the opioid-like peptide, analgesic peptide. ठीक है. Now next, milk and milk product also constitute one opioid peptide. Milk में भी आपके दूध में भी एक opioid peptide होता है, such as a casomorphin. Is known as casomorphin. Beta-casomorphin. Casomorphin is a opioid-like peptide present in the milk, also has an analgesic activity. Now, a mechanism of action of your opioid analgesics. So, depending upon the dose-dependent effect used to bind with the different receptors known as a mu, kappa, and delta. These are known as a opioid receptors. Opioid receptor होंगे आपके kappa and delta. Those opioid analgesics, they will interact with this receptor. Either they will act as agonist, or they will act as a partial agonist, or they will act as an agonist antagonist to one of the following receptor or all of the following receptors. By interacting with this receptor, they will produce sedation, euphoria, decrease in the pain sensation, and all that. Okay. Remember, they will interact with these receptor. They are known as the opioid analgesics. See the next. What are the different opioid receptors? I have told you mu, kappa, and delta. These are the three opioid receptors. So we'll see in the detail regarding these receptors. Opioid receptor and their pharmacological effect. So on this portion also, they in GPAT 2020 there was a question. So, mu receptor is responsible for what? Receptor is responsible for what? And delta receptor is responsible for what? We used to ask question on this. So what is mu receptor? We'll see the location where it is located and what is the function of it. तो ये म्यू रिसेप्टर कहाँ पे होता है, इसका काम क्या है, आपको मालूम हो जाएगा. If drug is a agonist to mu receptor, एक ड्रग का फार्माकोलॉजिकल एक्शन आपको समझ में आएगा. अदरवाइज तो रिसेप्टर बहुत ही ज़्यादा इंपॉर्टेंट होता है आपको. म्यू रिसेप्टर, सो दीज आर थ्री रिसेप्टर, दे आर नोन एज ओपॉइड रिसेप्टर्स. म्यू, कप्पा एंड डेल्टा. माइक्रो, इसको माइक्रो भी बोलते हैं, तो माइक्रो भी बोलते हैं कभी. ठीक है. It is denoted by micro symbol. Kappa is denoted by K symbol. Delta is denoted by delta symbol. You know all the symbols. First, mu located on the supraspinal region, responsible for the supraspinal or spinal analgesia. Supraspinal or spinal analgesia. Then, drug that can interact with the mu receptor will produce euphoria. is responsible for the euphoria and respiratory depression. Now what do you mean by euphoria? ये म्यू रिसेप्टर जो है एनालिसिया के लिए रिस्पॉन्सिबल है कहाँ पे, स्पाइनल एंड सुप्रास्पाइनल रीजन में. उसके बाद में ये यूफोरिया भी करता है, रेस्पिरेटरी डिप्रेशन करता है. यूफोरिया क्या होता है? यूफोरिया मीन्स फॉल्स फीलिंग ऑफ वेलबींग. यूफोरिया मीन्स फॉल्स फीलिंग ऑफ वेलबींग. आपको किसी ने गोली मार दी और आप हंस रहे हो, दैट इज यूफोरिया, फीलिंग ऑफ वेलबींग. ठीक है, ऑल इज वेल. अरे गोली लगी है तेरे को फिर भी बोल रहा है ऑल इज वेल, नहीं. ठीक है, दैट इज यूफोरिया. सो मॉर्फिन का इंजेक्शन दे दिया उसको, उसका पैर आप उसके सामने काट डालो, उसको कुछ नहीं फील होगा. Euphoria because morphine produces euphoria. Supraspinal spinal analgesia is because of the mu receptor. Euphoria is also because of the mu receptor. Then respiratory depression is also because of the mu receptor. So it will also responsible for the sedation. Meiosis means decrease in the pupil size. आपका pupil size कम होगा. Decrease in the GIT motility. It means that is a constipation. Okay. So those drugs which will interact with the mu receptor, they will produce analgesia, euphoria, respiratory depression, sedation, pinpoint pupil. Meiosis means pinpoint pupil, and constipation, decrease in the GIT motility. Then smooth muscle spasm, physical dependence, release of prolactin and growth hormone. Also cause nausea and vomiting. Those drug, for example, morphine is a agonist to mu receptor. Okay. Agonist to mu receptor. So it will cause analgesia, euphoria, respiratory depression, sedation, pinpoint pupil, constipation, smooth muscle spasm in the GIT, and vigorous spasm in the GIT is nothing but the kick. जो मॉर्फिन एडिक्ट होते हैं वो उनको मालूम. Then physical dependence, release of prolactin hormone, nausea and vomiting. See, responsible for the sedation, analgesia, constipation, respiratory depression, and truncal rigidity, euphoria and meiosis. Okay. The next receptor is the kappa receptor. So it is also present in the supraspinal and spinal region, responsible for the analgesia. Supraspinal and spinal analgesia. Sedation, meiosis, decreased GIT motility. It will cause less physical dependence as compared to mu receptor. So those drugs which are a full agonist to mu receptor will cause, they are prone to high addiction property. So those drugs which are interacting with the kappa receptor only, they are less prone for physical dependence. Okay, so like that. This kappa receptor is also responsible for the dysphoria and psychometric effect, diuresis, wedding, etc. Responsible for the dysphoria, constipation, and analgesia. Next one is known as the delta receptor. This is the location and what is the function of this. So again, it is located in the supraspinal and spinal region, responsible for the analgesia. It has a less respiratory depressant property. Those drugs which will interact with the delta receptor, they will not cause respiratory depression. It also decreases the GIT motility. Then remember, those drugs which will interact with the mu receptor, they will mostly produce analgesia as well as euphoria, sedation, meiosis, then respiratory depression and physical dependence. So as compared to mu receptor, kappa receptor is less prone to physical dependence. As compared to both our delta receptor is less prone to physical dependence. So okay, delta receptor is responsible for spinal analgesia, modulation of hormone and neurotransmitter release. Another one is there known as nociptine or orphanine receptor. It is mostly associated with the behavior. So drug reward and reinforcement, stress responsiveness, learning and memory. So this receptor is responsible for the drug reward. मतलब so वो अगर ड्रग मिला नहीं आपको तो आप चिल्लाओगे, काटने को दौड़ोगे, इंजुरी कर लोगे आपको. So the dependence is because of this nociptine or orphanine receptor. Stress responsiveness, learning and memory. So these are the opioid receptor. Remember. Then next one is examples of drug which are interacting with these receptors. So selectivity of common opioid analgesic drug with different receptors. तो हर एक ड्रग कौन से रिसेप्टर को एगोनिस्ट है, कौन से को एंटागोनिस्ट है, ठीक है, उसके बारे में यू कैन सी ओवर नेम ऑफ ड्रग and their receptor. So three kind of receptor as I have told you already, mu, kappa and delta. First we'll see pure agonist. तो first we'll see pure agonist. पहला कौन है pure agonist? Pure agonist कौन है? वो morphine, methadone and codeine. Morphine, methadone and codeine. It is a full agonist. Agonist. It has a highest agonistic property for mu receptor, morphine. It also has a, as compared to mu receptor, it is a less agonistic property with the kappa and less agonist to delta again. Okay, but remember morphine is a, it has the highest agonistic property for mu receptor. Then methadone. Methadone is a synthetic derivative. It is again agonistic to mu receptor. Will not have any action on kappa receptor. No any action on delta receptor. Codeine is a less agonist. Codeine is a less agonistic to muscarinic receptor. That's why codeine is a less potent than morphine. It is a less agonistic to the mu receptor. Again, it is also agonist to kappa receptor. No action on delta receptor. This was the agonist. They are the full agonist. Now, partial agonist. Full agonist means what? Those drugs which will interact with the receptor and produce a pharmacological action. Full pharmacological action. They are known as a full agonist. Now, partial agonist means what? Partial agonist means those drugs which will also interact with the receptor, but they will not produce full pharmacological action. They will produce a partial response or submaximal response. So, these drugs will produce maximal response. Okay, now, partial agonists like buprenorphine, torphenol, then propyram, okay, propyram, buprenorphine, butorphanol. These are known as a partial agonist. Okay, buprenorphine is a partial agonist to mu. It is an antagonist to kappa receptor. There is no action on delta receptor. So buprenorphine may, it is a mu receptor partial agonist and antagonist to kappa receptor. Okay. Then butorphanol is also again, it is a partial agonist to mu receptor. It is a full agonist to kappa receptor. No action on delta. Propyram, again it is a partial agonist to mu receptor. It is an antagonist to kappa receptor and again antagonist to delta receptor. Then next class, there is class 3. Class 3 is known as a agonist antagonistic drug. So this was a full agonist or pure agonist. This was a partial agonist. Now third one is a agonist antagonist type drug. So pentazocine, first one is pentazocine. It has an antagonistic property for the mu receptor. It has an agonistic property for the kappa receptor and again less agonistic property to the delta receptor. Next one is a nalbuphine. Nalbuphine also having antagonistic property for the mu receptor, partial agonistic property for the kappa and small agonistic property for the delta. So you can see over. So again यहाँ पे क्लासिफिकेशन आपका रिपीट हो चुका है. प्योर agonist मॉर्फिन, मेथाडोन, कोडीन. इसमें और भी एग्जांपल्स है, ठीक है. ये तीनों एग्जांपल्स है आप एक कंपैरेटिव स्टडी के लिए दिए. देन पार्शियल एगोनिस्ट कौन है? बुप्रेनॉर्फिन, ब्यूटॉरफेनॉल, प्रोपायरम. एगोनिस्ट एंटागोनिस्ट कौन है? पेंटाजोसिन, नालबुफेन. Okay, these are the agonist antagonists. We'll see all the details of pharmacology, this opioid analysis in the upcoming slides. So you can see morphine. Okay, opium. If you know the opium, the dark brown secretion from that opium poppy, that is nothing but the latex from opium poppy. So in that latex you will have alkaloids. That is known as opium alkaloids. So opium alkaloids, they are mainly classified into two groups depending upon their chemical structure. So first group will be a phenanthrene type of alkaloids or phenanthrene series alkaloids. So in that you have morphine, codeine, thibane. So this morphine, codeine, thibane, they will have a similar type of basic skeleton. So for example, this is known as a phenanthrene ring. So फेन मतलब याद रखो, फेन मतलब फेनाइल रिंग, एंथ्रीन मतलब एंथ्रासिन. सो दो रिंग्स अगर अटैच है तो एंथ्रासिन हो गया और एक फिनाइलिन, सो फिनानथ्रीन। या फिर आप ऐसे भी याद रख सकते हो, थ्रीन मतलब तीन, फिना मतलब फिनाइल, तो तीन फिनाइलिन। So these are the phenanthrene derivative. Morphine, codeine, thibin. Another class is there, benzyl, isoquinoline alkaloids. So there you will not have phenanthrene. There you will have benzyl isoquinoline. In that you have papaverine, nascopine, and narcin. So this phenanthrene series will have analgesic property. Morphine is analgesic, codeine is analgesic, thibin is not analgesic. Then papaverine is not having analgesic property. It is mostly antispasmodic in nature. Remember, this is the structure of your morphine. So if you replace this hydroxyl group by methoxyl group, it is known as a codeine. And if you replace both these two hydroxyl group with the methoxyl group, that is known as a heroine. We'll see that in the medicinal chemistry point. When we'll see the same chapter from medicinal chemistry point of view. At that time I will tell. Now here, pharmacological actions. Pharmacological actions of opioid analysis. So each and every drug will not be discussed. Morphine will be discussed in the detail because morphine is a prototype of this opioid analysis. तो मॉर्फिन क्या है, प्रोटोटाइप है, तो उसका थोड़ा डिटेल में देखेंगे क्या करता है सीएनएस के ऊपर, जीआईटी के ऊपर क्या करता है, रेस्पिरेटरी सिस्टम के ऊपर क्या करता है, इसका डिटेल में देखेंगे, बाकी ड्रग का उतना डिटेल में नहीं रहेगा. तो मॉर्फिन इट इज यूज्ड एज अ sulfate salt or either hydrochloride salt for pharmacological purpose. Sorry, for the pharmaceutical purpose. So morphine sulfate is also available. Morphine hydrochloride salt is also available. Now, what are the different action of morphine on CNS? CNS के ऊपर क्या actions है इसके? First is known as analgesia. Analgesia means it will decrease the pain. Analgesia. So increase in the pain threshold. It will increase the pain threshold. थ्रेशोल्ड जितना इंक्रीज करेंगे उतना आप ज्यादा पेन बेयर कर सकते हो. आपको पेन होता है उसका मतलब क्या होता है कि आपका पेन थ्रेशोल्ड कम हो चुका है, तो यू कैन नॉट बियर द पेन, आप सही नहीं सकते हो, आपको दर्द असहाय हो रहा है, आप सही नहीं सकते उसको. सो पेन विल इंक्रीज द पेन थ्रेशोल्ड देयर बाय रिड्यूसिंग द परसेप्शन ऑफ पेन. तो पेन का सेंसेशन कम हो जाए, थ्रेशोल्ड इंक्रीज करेगा, पेन बियर करने का ताकत बढ़ाएगा. ठीक है, आपको पेन बियर करने का पोटेंशियल बढ़ेगा. सो दैट्स व्हाई it will increase the threshold of pain, thereby reduces the perception of pain. And this action is assisted by false feeling of well-being. Okay, so it will increase the pain threshold and also produces the euphoria. Euphoria means false feeling of well-being. All is well. गोली लगी है फिर भी बोल रहे हैं all is well. गोली लगी है मर जाने वाले. Okay, so euphoria means false feeling of well-being. It will produce analgesia along with the euphoria. That property is also very useful. That property is also very bad because analgesia with euphoria, this property makes morphine as a very potent analgesic. It can be used in the terminal case of cancer also. The same property makes morphine as a worst drug because of that euphoria, it is liable for the addiction. So most worst and most best drug for pain, that is a morphine. Without causing any motor incoordination, it will produce euphoria. It will not sedate you. It will produce euphoria without causing motor incoordination. आपको sleep नहीं करेगा, आप नींद में नहीं जाओगे. In moderate doses, it reduces the continuous and dull pain. Larger doses can reduce the sharp intermittent type of pain and caused by trauma and visceral pathology. आपके visceral organ को कोई trauma होगा, वहाँ से जो pain आ रहा है, sharp pain, that will also be decreased by morphine. Dull type of pain is also decreased by morphine. That is the analgesia. Now what is next one is euphoria. Euphoria means false feeling of well-being. Sedation, hypnosis. Euphoria, sedation and hypnosis. So in smaller doses, it will only produce euphoria. If you increase dose, it will sedate you. Means it will induce the sleep. It will produce the calmness of nerve. And if you increase still dose, it will produce the sleep. That is the hypnosis. So euphoria, sedation and hypnosis. Morphine produces sense of well-being, false sense of well-being. That is known as euphoria, which eliminate normal fear, panic, and withdrawal and flight response for the pain. जैसे होता है ना, आपको थोड़ा सा भी कहीं कुछ चुभा तो आप फटक से आपका हाथ बाजू, आपका जो हाथ है वो बाजू को ले लेते हो. दैट इज अ nothing but the flight response, withdrawal and flight response to the pain. Okay. Now morphine produces euphoria and eliminate your fear. आप जिससे डर रहे हो, एक नोकीला कील आपके सामने, किसने बोला कि उसके ऊपर हाथ मार दो आप, तो आप बोलेंगे पागल है क्या तो, है ना, क्योंकि वो अगर आपके कील हाथ में घुस गया तो आपको पेन हो जाएगा. दैट इज अ विड्रॉल और फ्लाइट रिस्पॉन्स. और गलती से आपने रख भी दिया हाथ तो फटक से विड्रॉ हो जाए. नाउ मॉर्फिन प्रोड्यूसेस यूफोरिया, sedation, hypnosis, and reduces or totally eliminates the fear of pain, the panic of pain. That's why the morphine अगर किसी ने ले लिया तो उसका कितना बीमार हो उसको कुछ नहीं होगा, इसके शरीर के ऊपर कितना भी कट्स करो कुछ नहीं होगा. It produces the euphoria even in absence of pain. Morphine produces the euphoria in presence of pain as well as in absence of pain. The production of this euphoria in absence of pain, it makes the worst drug of abuse. It produces euphoria even in absence of pain, which makes it the worst drug of abuse. A large dose can induce the sleep and which will resemble to natural sleep. That is a euphoria. Now next one is a morphine depresses the respiratory center. So what is the action of morphine on respiratory system? So it will depress your respiratory system. So it will depress the respiratory and curb center and stimulate the vagal and oculomotor center and CTZ. इसका मतलब क्या होगा अभी देखो यहाँ पे एक्सप्लेन करता हूँ कि मॉर्फिन का तीसरा एक्शन क्या है सीनेस के ऊपर. मॉर्फिन डिप्रेसेस द रेस्पिरेटरी सेंटर एंड कर्ब सेंटर. सो रेस्पिरेटरी सेंटर को डिप्रेस करेगा तो क्या होगा, आपका रेस्पिरेशन कम हो जाएगा, आप मर भी सकते हो. तो बिकॉज ऑफ दैट, सो रेस्पिरेटरी डिप्रेशन प्रॉपर्टी इज वेरी बैड. Depresses the cup center. It depresses the cup center. That means it is useful in the cuff also. Stimulate the vagus nerve. It will stimulate the vagal action. That means it will stimulate the vagus nerve and it will show cholinergic type of action. So whatever action given by acetylcholine that will be produced. Also stimulate oculomotor center, CTZ. Also stimulate the CTZ. CTZ means chemoreceptor trigger zone. Stimulation of CTZ causes vomiting, emesis, and nausea. Okay, so stimulation of CTZ causes nausea, emesis, and vomiting. Respiration के ऊपर it is a depressant action. So it will depress the respiration by two mechanisms. Direct depression of respiratory center first, and it decreases the sensitivity. It decreases the sensitivity of CO2. It decreases the sensitivity to the chemoreceptors. जो chemoreceptors होते हैं आपके बॉडी, so they are sensitive to change in the chemical structure. Okay? Change in the chemical. So if there is an imbalance, if there is increased carbon dioxide. So if there is increased carbon dioxide in your blood, so the signal will be transmitted to brain by chemoreceptor to increase the respiration. Morphine will directly depress your respiratory center as well as it will decrease the sensitivity of chemoreceptors to the plasma carbon dioxide. नॉर्मली आपके ब्लड में कार्बन डाइऑक्साइड बढ़ गया तो केमो रिसेप्टर आपका एक्टिवेट होके वो सिग्नल भेजेगा ब्रेन को, ठीक है नॉर्मली. लेकिन आप अगर मॉर्फिन के अंडर हो ट्रीटमेंट के अंदर या फिर मॉर्फिन लिया है आपने तो आपका केमो रिसेप्टर्स जो है वो डिप्रेस हो जाए. चंकी स्ट्रोक रेस्पिरेशन, peak toxic dose of morphine with breathing is entered. Okay? So it will produce chunky stroke respiration. Morphine will produce chunky stroke respiration. Then toxic dose of morphine. If you take a toxic dose of morphine, then at the time breathing is entirely maintained by a hypoxic drive. There are two type of drive that maintain the respiration: hypoxic drive and hypoxic drive. So that is hypoxic drive means that is maintained by that is a chemoreceptor maintained by hypoxic drive through chemoreceptors of aortic and carotid body. There are two mechanisms. First one is the respiratory center. तो वो आपको रेस्पिरेशन कंट्रोल करता है रेस्पिरेटरी सेंटर. दूसरा एक होता है हाइपोक्सिक ड्राइव और that is by through chemoreceptors. Okay, so now आपने मॉर्फिन का टॉक्सिक डोज लिया तो रेस्पिरेटरी सेंटर तो आप पहले ही डिप्रेस हो चुका है. So now whatever respiration is there, that is only maintained by hypoxic drive, and this morphine also decreases the sensitivity of chemoreceptor to carbon dioxide. That's why chunky stop respiration. Then pupils के ऊपर क्या है? Morphine will produce pinpoint pupil. Morphine will produce characteristic pinpoint meiosis. Okay, due to action on this, due to action on Edinger Westphal nucleus of oculomotor nerve, it will decrease the it will cause pinpoint. Then nausea in emesis, it is a stimulant to CTZ. Morphine will stimulate chemoreceptor trigger zone, and that why it produce nausea, vomiting, and emesis. Now it can be controlled by nalorphine, cloprazine, metoclopramide, and haloperidol. Morphine also is a cup suppressant. So morphine has a cup suppressant action. So cup suppression by depression of cup reflex and direct depression of cup center. It decreases the cup or it suppresses the cup. Then it also stimulates the vagus nerve. That is a vagal stimulation by morphine result in the bradycardia. Vagal stimulation मतलब ये क्या करेगा? Vagus nerve को stimulate करेगा, acetylcholine release करेगा. So that will cause bradycardia, a decrease in the heart rate. Increase in the reflex excitability of spinal cord also produces release of antidiuretic hormone. तो एंटीडायरेटिक हार्मोन को रिलीज करेगा तो ऑब्वियसली यूरिनरी रिटेंशन होगा, यूरिन रिटेंशन. सो दैट इज these are the actions of morphine on CNS. और भी कुछ actions है. Now remaining actions are there, actions of morphine on GIT and all.